Hi everybody, welcome again to Dr. Manny's YouTube Learnshops. This is part 2 to data collection in qualitative research. The objective for this session is to review data collection methods, looking at observation, interviews which can be single face-to-face or focus group, review what a reflective diary is, have some form of comprehension about photo-elicitation in relation to interviews, and self-report narratives, which can also be used for data collection. Let's just reflect and review. Research categories. Social science research often fits into one of two categories. It's either qualitative or quantitative. You're doing qualitative research in this course. Qualitative research, as we've discussed previously, focuses on human behaviour from the participant's point of view, which is absolutely essential in nursing. We focus on the human being, primarily holistic care. Patients are not numbers. Patients are people. In quantitative research, this seeks a numerical or a statistical fact which is commonly found across a large, randomized, defined group, which is essential as well from a research point of view. However, it deals with numbers, facts, which sometimes can be controversial from a qualitative point of view. Common research approaches include ethnography, phenomenology, grounded theory, which we've discussed in previous sessions. It can also include case studies, historical and narrative perspectives. Let's review. In the ethnographic model, we said previously the goal was to learn and describe the culture's characteristics, much the same way anthropologists observe the cultural challenges and group motivations. Originally, culture was linked to the notion of ethnicity and its geographic location, but it includes virtually any group, which could be nurses, or organisations, which could be the nursing profession. The researcher actively becomes an active participant. They observe, interview, record, make extensive field notes about their participants, subjects, those being observed. In a healthcare model, it's central to understanding patients or healthcare professionals such as nurses. And in the ethnographic model, there's no preset time limit of what will be observed and no real ending point to the study. It could go on for years and years and years. Then you've got the grounded theory method or model. And the objective is to develop a theory about phenomena of interest. As we've indicated previously, it can be complex, and it's a cyclic, iterative process, which commences with the generative question, which essentially guides the research. Initially, there's open coding, identifying themes, codes, then selective coding, subcategory identification or creation, category creation, which concludes with one core category that's central. It can use interviewing with open-ended questions, fieldwork observation, and focus groups. Also artifacts and text, which can be historical or documentation in relation to the topic of inquiry. There's no preset limit on what data can be collected, and again, no real ending point. However, once data saturation has been achieved, that's when the research study concludes. Well, data collection concludes anyway. In a phenomenological study or method, this is considered a philosophical perspective as well as a methodology. The disciplines include psychology, sociology, nursing and social work, as is included with all the other methods. The focus is on the subjective experience and interpretations of the world, which is generic with all qualitative research. Phenomenologists want to understand how the world appears to others, their lived experiences. The goal is to describe how people feel about an experience or a specific event, which we call a phenomenon. And it also can use interviews, observation, and surveys to gather information. Now, data collection methods. The most common methods are interviews, focus group discussions, and observing. As we've indicated previously, combining two or more data collection methods, such as interviews, focus groups, journal reflection, this is data triangulation. And data triangulation enhances, promotes credibility of the research study. It promotes rigor, quality of the study. Now, if we look at interviews, interviews are useful to explore experiences, views, opinions, or beliefs about specific matters. You're talking to your participant. You're talking to the subject. You're gathering information. These are accounts that can be explored and compared to others to develop an understanding of the underlying structure of the beliefs. And there are different grades of structuring in an interview. It can be structured, unstructured, or a combination of both, semi-structured. What are some of the types of interviews? As already just mentioned, there are 3 types of interviews that are common in social sciences or social health. And these are structured, unstructured, and semi-structured. And they typically involve doing your pre-work, opening the interview or questioning, the core and closure. In the opening, this is where you introduce the content of the setting and you build rapport with your participant. In the core, you probe and seek information, and at the same time you can be observing and assessing and making notes. In the closure of the interview, you're answering any queries, you're giving feedback, you're clarifying, and you're explaining what you're going to do next in relation to the research process. And this can involve assessment and decision making. When we look at structured interviews, a structured interview, this is an interview with predetermined questions. It's structured, it's organized, it's very organized. And they're prepared by you, if you're the interviewer, in advance. And structured interviews can be applied to face-to-face interviews, phone interviews, video phone interviews, internet videos online, computer programs such as WhatsApp, Skype, Google Hangouts, Appearin, Ovu, Viber, Talkie, Voca, etc. There are numerous. Structured interviews are objective. so typically related to quantitative research and researchers. The interview questions can be open-ended or closed-ended. Typically, they're closed. Structured interviews, this is where the researcher often begins with polite conversation, making rapport. It gives a brief overview of the study. The researcher uses a list of pre-prepared questions. He or she writes down the responses or audio tapes them. Each participant, however, is asked the same question or questions and in the same order. The researcher makes notes and overall gets a sense of what the participant is saying in response to the questions. What are some of the advantages of a structured interview? Well, you've got a pre-prepared list. So no important questions are typically missed. You can get a lot of information, rapid data collection with the same questions. And comparisons to the participants' or subjects' answers are relatively easy. The questions are objective, not subjective. And as a consequence of that, there's reduced bias in the opinions of the study participants. And the researcher has no input at all, so there's no researcher personal bias to contaminate the data or affect rigor or quality or validity and reliability. What are some of the disadvantages of structured interviews? They do take more time to plan and prepare compared to unstructured interviews. The researcher will miss opportunities to go in depth to get data, but that isn't the objective of the research in a structured interview. And as a consequence of that, it's difficult to ask more broadened questions on the area that you're interested in. The interviews that are structured can appear impersonal, often more like an interrogation. You just want the answer. And data from an observation may be missed compared to unstructured interviews. When we look at unstructured interviews are typically used in qualitative research, and they can go in any direction. The questions are not predetermined. The questions are more conversational, unrehearsed, and asked as open-ended questions to determine participants' perceptions, views, beliefs on the topic of interest. The important thing in an unstructured interview is to collect and record information accurately. The researcher can always return to the topics that were not explored at that specific time that they were mentioned. The researcher also makes notes to remind themselves to go back and ask more about certain topics that may have been uncovered and not answered at that point in time. The general rules related to unstructured interviews are: avoid leading questions. Don't suggest anything. It's not your role. You're asking the question. You don't preempt, you don't push, you don't suggest. However, you can probe beyond the provided answer. So if you want additional information in relation to the participant's response, you can probe further. And that allows you to explore any conflicts discrepancies, contraindications, contradictions that the participant may make. And you record and transcribe everything in the participant's own words, which typically now you can record. There's a good tool, and there are lots of these tools available. STAR is one of them. STAR essentially means, it's an acronym. S, situation, describe the situation. T, the task. What was your task in this situation? A, action. What did you do in that situation? R, results. What were the results that you found? Here's an example of an unstructured interview. You're the researcher and you ask the question, what kinds of illnesses do children in your village get? The caregiver, which could be the mother. Well, diarrhea is the most common. The researcher then continues. Are there any others? The caregiver. Well, measles, pneumonia, and whooping cough, they occur as well. The researcher. Can you tell me something about measles? Which again the researcher may be specifically interested in. The caregiver. During measles, it's good to give cold water because measles is very hot. The child should be kept in the house away from other children. The researcher then focuses on that response. Why? Why should the child be kept in a house away from other children? The caregiver. Because measles spreads from child to child very easily, indicating that it's contagious. The researcher, well, how do measles spread from child to child? The caregiver, I think it must happen through smell and sweat. Maybe it happens when the child touches something a sick child has touched. I'm not really sure. Smell, maybe they're thinking about airborne. Breathing. The researcher then goes on. You said the diarrhea is a common disease in children. Is that spread from child to child as well? The caregiver? No, not usually. Only some kinds of diarrhea are. The researcher wants to probe further. Which kinds can be spread from child to child? The caregiver. I think peach, which refers to bloody diarrhea, and this is spread in a way because once a child in a family gets it, others tend to get it as well. So the unstructured interview can lead in any direction that the researcher chooses to follow in relation to further probing questions. What are some of the advantages of an unstructured interview? Well, it allows the researcher to probe deeper. As the researcher, you can go into more depth on a particular topic or focus or answer that's been provided by the participant. It allows you to adapt to changing topics. It's very flexible. It allows questions to be adapted and changed depending, as I said, on the participant's answers. It allows you to improvise with interview questions. If the researcher, you, is good at coming up with questions on the spot and making the participant feel comfortable, it can create a much more relaxed atmosphere which will or may provide additional information that you weren't anticipating. So what are some of the disadvantages of an unstructured interview then? Well, first, getting distracted during the interview. And if you get distracted without having questions prepared in advance, you as the researcher may forget something or miss something that's important to know. You could misjudge the participants because your questions always vary a lot. So one participant, you may ask one set of questions, and other participants other questions. And some of the questions in the initial interview may have been important for the secondary interview. So it's much harder to compare apples to apples when reviewing transcripts because the questioning is sort of different. And this may result in data that's untrustworthy, and it may be subject to bias. There's also unpredictability of the participants' responses, and depending on your skills as a researcher, with unstructured interviews, the information can be less reliable. So practice makes perfect when conducting an interview. But that could be a limitation of your study as well. So don't be too hard on yourself. Then you have a combination of both, semi-structured interviews. And as I said, this combines both structured and unstructured interview methods. And this is where the researcher develops and does use an interview guide, but it's not as structured. It's sort of semi-structured. And this is a list of questions and topics that need to be covered during the interview, and usually in a particular order. And the researcher does have a guide that he follows, but can permit the study participants the freedom to express their views in their own terms. And this allows both objective, quantitative, or subjective, qualitative, data collection. A combination of both. What are some of the types of interview questions that you can use in all interviews? You can use closed-ended questions and open-ended questions. Closed-ended questions can simply be answered by yes or no, or I guess, I don't know. For example, is UniMass a good university? Yes, no, I don't know. Are the lecturers knowledgeable? Yes, no, or I don't know. In open-ended questions, this requires a more comprehensive answer, using the subject or participant's own knowledge or feelings. For example, why did you choose to study at UniMass? Tell me about your qualitative research course. Describe your relationship with your supervisors. How do you see your future as a researcher in Malaysia? Now, closed-ended questions asks all the participants for the required right information. For example, do you have pain? The participants responding can only answer yes or no. They answer objectively, and there's no possibility for further explanation. Do you have pain? You either have it or you don't. In open-ended questions, it asks all the participants to respond in a personal way. For example, can you talk to me about the pain that you've been experiencing for the last few days, weeks, or months? The participants responding can explain, open up, elaborate about any aspect of their pain. And pain is subjective. So subjectively, there's every possibility for further explanation or generation of further questions. Tell me more. How does that make you feel? Can you give me an example? Can you describe that for me? How was that feeling? Why do you think it occurred? Open-ended questions. The cartoon is quite humorous. The female is saying to the male, who's the researcher, the client would prefer fewer open-ended questions because they can be time-consuming, getting all the information. When we look at individual face-to-face interviews, these are in-depth. Typically, they're single participant interviews. It's about in-depth data collection and comprehensive understanding, and it allows you as the researcher to probe attitudes, beliefs, desires, experiences. And you can observe body language and facial expressions which are more clearly identified and understood. And you as the interviewer can probe for explanations of responses. So for example, you might see a facial expression that indicates grief or pain. You may want to explore that. Maybe not at that time, but later on you might say, look, during this questioning period of time, I observed that you became very distressed facially. Why? Why did that happen? The interview length can be considerably longer since the participant has got a greater commitment rather than just answering yes or no. You've also got what is called method face-to-face, which can be observed on a phone or video conference, or instant messaging systems. Body language is really important because it tells you a lot about what the participant is feeling or experiencing during a face-to-face interview. When we look at focus group interviews, well, this examines how group social knowledge is produced. Because you can see the interaction between the participants. It can be positive, it can be negative. It can be superior, it can be inferior. Focus group interviews also act as a member check. Another way of thinking about it is participant validation to improve rigor, quality, accuracy, credibility, validity, and possibly transferability of a study. You're going back, you're observing. One participant is agreeing with another participant that that is correct. And you could be going back saying, look, this is my analysis of what you're saying. Is it correct? Member checking. The researcher can stimulate discussion in order to examine how knowledge and the ideas develop and operate in a given group. Nurses. You can also handle sensitive issues, which might be more easily discussed within a group, although other personal information might be withheld. So for example, what we're saying here now is that if you've got some sort of controversial issue, the participant or participants may feel more confident to discuss it openly rather than individually or in private. However, by the same token, they may be unwilling to share personal information in a group. Focus group interviews, face-to-face interviews, all have their benefits, their advantages and their disadvantages. In a focus group interview, however, the role of the researcher is to create an open atmosphere. Make sure that the participants are comfortable, not feel threatened or insecure. And this will involve participants more so in the discussion. A safe, open, secure atmosphere with privacy will increase or should increase participants' discussion, we're having a focus group to test which questions to ask in our next focus group. Because again, the questions can be validated by the group rather than one. And if the group validate the questions, then they may be more appropriate to use in the real study. That's the purpose of a pilot study. Another tool can be observation. An observation means to examine an object or an individual or a group of people or an event with all your senses. Sight, hearing, sometimes touch, smell. So therefore, observation is a technique that involves the senses by directly observing behaviour for your purpose to describe it or explain it or examine it. The observer, you, may record absolutely everything that happens during the interview. In ethnography, this usually involves the researcher participating, whether it's overtly or covertly, in people's daily lives for an extended period of time. You watch what happens. You listen to what's said. And you may or may not ask questions. And if you do, it can be informal or formal, as an interview, collecting documents, or as we mentioned previously, artifacts. Observation. Observation can give you a lot of information, additional information that you can't get if you're not observing and recording. Field notes, which can be obtained during the interview. What are some of the types of observations that you can make as a researcher? Well, you've got participatory observation. And this is when the observer, you, participates with the people and in the events that you're observing. And typically this occurs in ethnography. Or you've got non-participant observation, when the researcher observes events without interacting with the persons being observed. Unstructured observation, and this is where you observe and record behaviour in a holistic way without the use of a predetermined guide. You fly by the seat of your pants. You just do and observe and record as it happens. Then you've got structured observation, where an observer observes events using a specific guide that's been planned well in advance. Participant observation, non-participant observation, unstructured observation, structured observation. A reflective diary journal or a reflective journal or a diary journal terminology is another method of gathering data, and it adds to data triangulation and rigour or quality or credibility or trustworthiness of the study. And this is a tool for collecting data, typically in qualitative research. And this is where written experiences, opinions, thoughts and feelings become an acknowledged part of the research design. It generates data, helps with analysis and interpretation as part of the process, and it can be used by both the researcher and the participant. Typically, it's used in behavioural studies to obtain information about a person's feelings, attitudes, beliefs, reflection. It provides an opportunity for participants and the researcher to reflect, to express their thoughts and experiences in a private, safe setting. So, for example, in a focus group, the participant may not have wanted to express what they really felt. So by using a reflective journal, they can take it away, home, a safe setting, and sit down and reflect about the same questions that the researcher asked during the focus group interview. Provides more data, and it's provided in a setting where the participant can reflect quietly, privately, safely, without any concerns about repercussion from other participants or the researcher themselves. They may be unwilling to ask they may be unwilling to answer in the face-to-face interview, but are happier to write down their thoughts about the same questions. This is an example of reflective probing. And if we put it into a student context, think about your experiences over the past week. This is what you're asking. Your answers should be related to your experience transitioning from the university to the clinical setting, let's say in a COVID-19 pandemic situation. Questions. What was your biggest challenge this week? What made it so challenging? How did you approach this challenge? Did anyone else help you with this challenge? If you experienced this challenge again, what would you do differently next time? How do you see this challenge relating to your undergraduate experiences? This is a form of probing. It comes to internet self-report narratives. And that may be a severe weakness which affects the trustworthiness of the data. Hello, do you have any opinions that fit into our preconceived questions? Yes and no. Now, when it comes to photo-elicitation interviews, Dr. Rukaya just wanted me to introduce you to it. As with all these, if you want further information, Google it. Go onto the internet. This could be a very important tool that could be used to gather information. But in this method, it uses visual images to prompt responses or comments from participants. It uses photographs or other visual mediums which can be very, very powerful in an interview to generate verbal discussion and create data and knowledge. I haven't used them in any interviews that I've done for my research. However, as I've reviewed this method certainly could evoke deep emotions and memories and ideas, which from my perspective did. And if it does that, it can contribute to the trustworthiness and the rigour of your findings through member checking. Because you could say to participants, have a look at this photograph. and tell me about it. Have you had any experience with this or that? And then you can go to another participant and ask the same questions and see what their responses are. So these are some examples where the researcher shows a picture in order to determine the participant's response. This is a photograph in the early 1940s during the Second World War, and I always look at it. I feel very, very sad, because this is where the Nazis rounded up Jews, the Jewish people, regardless of their age, infants, children, adolescents, adults, geriatrics, and essentially exterminated, committed genocide to approximately 7 million Jews in Germany, not including another 4 million in other countries, as well as the German people who didn't agree with the regime's policies. It makes me feel really, really sad, because my parents were both German. My grandfather was imprisoned for speaking up against the regime. This photo very bad. Car accidents. I mean, you may be talking to participants about drunk driving, and this photograph could bring up thoughts, ideas, memories. Child abuse. Common in every country, and even more so during the COVID-19 pandemic. I look at it and I feel really sad that a child, regardless of gender, has to go through what some of these children have to go through. Generic to a lot of countries. Okay, so in conclusion, there's no best data collection technique. Each technique has got its advantage and its disadvantages. The important thing is suitability and appropriateness, and that depends on what's the purpose of your research, what's the scope or research, and what are the resources that are available to you for that research. Okay, thanks everybody. As previously, if you found this session worthwhile, check out some of the other Dr. Manny Learnshops on YouTube. Okay, bye for now.